Alright, so I am getting ready to go get my pump disconnected after 8 cycles. Trying to figure out if my camera's about to fall over or not. Looks like it is. Just doesn't want to stay straight today. Anyways, about ready to go get my pump taken off after my 8th cycle of chemo. I've been doing chemo now for going on 6 months. Little side effect there is I get to push down some weird intestinal crap. But anyway, looking forward to this phase being over. This is day 3 since I got my chemo hooked up. And this will be the last time I go to get my pump disconnected. So, kind of some weird feelings. I'm actually starting to get excited that it's over. I talked with my oncologist on Monday, and he seemed a lot more acceptant of my position and kind of where I'm coming from with all of this, in that I think that he in good conscience cannot recommend anything less than the recommended treatment cycle, which is 12. But I do think that he understands my position, given that I have stage 2, that my Signatera came back negative, that my CEAs are good, that my cancer did have a high indicator of CEAs. So I will be going back for follow-up for basically the next 5 years of my life. I will be monitoring to make sure that the cancer doesn't reappear. But I am very confident that the vast majority of it was removed during surgery, during my resection, and that the chemo that I have gone through will have remediated any cancer that is in my blood as of now, and that I should be able to live a cancer-free life, at least from this colon cancer that I did get. That being said, it's always going to be in the back of your mind. It's never going to go away. The last 6 months of my life is not something that I'll ever forget. And I'm really now starting to look forward to the future, starting to get excited about things again, now that I have the prospect of not having to endure these chemotherapy treatments, which are pretty brutal. I'll be able to start working out again, start just living my life, which this chemo has really put it on hold. And I don't think I really understood necessarily the psychological impact that the chemotherapy was having on my life and how depressing it really is. These last week I really got depressed, and it was really starting to get me down, having to go do another chemo cycle. And I don't think that the psychological impact of it is talked about enough. I think we focus a lot more on the physical side effects of chemotherapy because it's so easy to see those, to explain those, but we don't really talk about, and you don't really realize that it's impacting you so much with the psychological side effects. But constantly having your physical health in jeopardy is hard to deal with, especially when you are relatively healthy and then all of a sudden all that is just taken from you and your whole life is just thrown upside down all at once. So, yeah, this is it. I will likely be doing some videos following up as far as my recovery from the chemotherapy. I do have the neuropathy in my hands that I feel often, some of the other things, and I will be talking about, recovering from it. I've lost a lot of physical strength. I can feel that. My body has deteriorated. My connective tissue is definitely not as healthy as it used to be, and I don't really feel like my muscle strength is, excuse me, another joyous side effect. But I intend to occasionally put something out just to keep people abreast of where I'm at. Probably will do that after some of the follow-ups that I go through on the monitoring. Happy to answer anybody's questions that anybody has. Part of this was a diary for myself, so that after I'm done with this, I could look back on these videos and remember what I was going through. But also to let other people know that you're not alone out there. that other people are going through this, that they've survived this, and that you can, and to give you hope and to hopefully let people know what the side effects are like. And I'll be doing a video after, I mean, the next 2 days are going to be rough for me. I'll not anticipating being out of bed. But somewhere down the road, I'm going to kind of go back and look at how I handled everything, how I would have done things differently, what I would have done the same, and really just kind of try to understand what I could have done better and what I did worse, and what I would have done the same. And hopefully that helps other people as they go through this and are able to hopefully make better decisions than I did. Just if somebody else can learn from this experience that I had, that would make me very happy. And I hope that I do help people. I want to say thank you to everybody that has been watching and providing their comments. It has helped a lot, and some of them have been very good. It's good to know that other people are out there that have been through this and that can relate, because when you're dealing with this in your life, nobody around you really, rarely, has dealt with this, so they don't understand really what you're going through and kind of what's going on. So anyway, I'm going to upload this video, and then I'm going to go get my pump disconnected. The last time I have to wear this stinky plastic smelly thing around. That is really annoying. Is the smell of it actually makes me sick, and it just serves as a reminder of what I'm wearing. But anyway, looking forward to getting that done, and looking forward to a cancer-free life, and definitely going to be enjoying things a lot more. Thank you, everyone.